Many older adults frequently complain of painful, stiff, or swollen joints, which are often considered as initial indicators of a potentially unavoidable condition known as arthritis. According to the World Health Organization, over 500 million people worldwide are currently living with arthritis. Among the affected joints, the knee is the most frequently affected, followed by the hip and hand. There are more than 100 different types of arthritis, each with unique development patterns, but all are characterized by pain and potential joint deformity. This condition affects people of all age, gender, and race. Greetings, and welcome to Lively Living Tips, your go-to source for daily tips on maintaining a vibrant and healthy lifestyle. Join us on this journey to discover valuable insights that will allow you to sustain a lively living. The most common types of arthritis include osteoarthritis and rheumatoid arthritis. Osteoarthritis is often associated with aging. It occurs when the protective cartilage that cushions the ends of bones in the joint deteriorates over time, whether from general wear and tear or due to underlying inflammation. This can result in pain, swelling, and reduced joint flexibility. Osteoarthritis commonly affects weight-bearing joints, such as the knees, hips, and hands. Rheumatoid arthritis is an autoimmune disorder in which the body's immune system mistakenly attacks the synovium, which is the lining of the membranes that surround the joints. Rheumatoid arthritis most commonly causes inflammation in the hands, wrists, and knees. It presents as morning stiffness that lasts longer than an hour, worsens with rest, and improves with activity. Gout is another form of inflammatory arthritis caused by the accumulation of uric acid crystals in the joints. It often affects the big toe and can cause sudden, severe pain, swelling, and redness. There is no known cure for arthritis, and you can't always prevent it. Some risk factors, such as being a female, age, and family history, are out of your control. However, a few healthy habits can help reduce your risk of developing painful joints as you get older. If you have healthy joints right now, do all you can now to maintain mobility and function and to avoid the pain and disability associated with arthritis. We have gathered few science-backed lifestyle modification tips for you today that might help you to prevent arthritis. Number 1. Exercise regularly. Even though it might seem like the last thing you want to do when you're in pain, exercise is beneficial for managing arthritis. Although exercise cannot rebuild the cartilage that had been eroded, it can strengthen muscles around your painful joints and increase bone density. This stabilizes them and can protect them from wear and tear. Exercise can be divided into 4 categories, and it's important to get all 4 types. Aerobic activities such as walking, swimming, and biking makes your heart pump faster and build endurance. This type of exercise can assist in shedding excess weight that may be contributing to joint pressure. Try to perform aerobic exercise at least 30 minutes for 5 days a week. Strength exercises into your routine, such as lifting light weights, using resistance bands, or utilizing your body weight, help strengthen the muscles supporting your joints. Strength exercises best suited for arthritis include leg extensions and table push-ups. Aim for at least 2 20 to 30-minute sessions a week of strength exercises. Flexibility exercises, including yoga, Pilates, and stretches like the quadriceps stretch, promote full joint mobility, prevent stiffness, and reduce the risk of injury. Allocate time for stretching at least 4 to 5 days a week, either post-workout or in the morning. Balancing exercises, such as Tai Chi, balancing on one leg, or walking heel to toe, contribute to improved balance and posture. For individuals with wobbly leg joints, these exercises also serve as preventive measures against falls. Integrate balance exercises few times a week to enhance overall stability. Number 2. Watch your weight. Being overweight increases the load that you put on your joints, especially in the weight-bearing areas, like the knees and lower back. It can cause arthritis to advance more quickly, perhaps due to higher levels of inflammation in the body. Not only can maintaining a healthy weight mitigate the risk of weight arthritis, it can also reduce arthritic pain and improve joint function in those who already have the condition. Experts say losing just 1 pound of weight can result in 4 pounds of pressure being taken off the knees in people with knee osteoarthritis. Losing as little as 10 pounds can reduce your risk of getting knee arthritis by almost 50%. Number 3. Avoid injury. With aging, joint wear and tear can occur, which can be accelerated by injuries from sports or accidents damaging the cartilage. Employ proper safety gear like knee, wrist, and elbow pads, and wear supportive shoes during sports. According to American Chiropractic Association, joint injuries are more common if you hold a position for a while. So avoid the prolonged standing and sitting in front of your computer or in the couch. Creating an ergonomic environment at home and in the office can help alleviate strain and pain on sensitive joints. Utilize ergonomic furniture, including a chair, keyboard, and mouse, to maintain a neutral position for your back, arms, and hands. Learn correct exercise techniques and avoid heavy lifting in the gym. If you have to lift heavy things during work, try to lift them using the knees and hips, not the back. Carry items close to your body to reduce strain on your wrists. Number 4. Eat a balanced diet. Research indicates that diet influences the risk and progression of arthritis, like rheumatoid arthritis. Pro-inflammatory foods like processed sugars, processed foods, saturated fat, red meat, refined carbohydrates, and salt increase inflammation risk, which can lead to arthritis. Foods such as turmeric have an anti-inflammatory component and may be a good option to incorporate into your diet. Other anti-inflammatory food, such as olive oil, flaxseed oil, fatty fish, whole grains, and fruits, especially citrus fruits into your diet, may be beneficial. Adequate water intake is also important, as water makes up 70% of the cartilage in joints and is vital for joint lubrication. Number 5. Quit smoking. According to CDC, smoking is the strongest known lifestyle or environmental risk factor for triggering rheumatoid arthritis. Smoking can also make the disease worse. Multiple studies have found that smokers exhibit higher levels of inflammatory cytokines, which are molecules that promote inflammation, compared to non-smokers. As rheumatoid arthritis is an inflammatory disease, researchers have also found that smokers were about twice as likely to develop rheumatoid arthritis than non-smokers. Smoking can also make exercising more difficult, which is important for managing arthritis symptoms. It can also affect your treatment outcome, as people who smoke don't respond as well to arthritis medications. Number 6. Control your blood sugar level. According to CDC, 47% of U.S. adults with diabetes also have arthritis. Arthritis and diabetes share common risk factors like obesity, insufficient exercise, and aging. Studies indicate that individuals with type 2 diabetes have an increased likelihood of developing osteoarthritis, even without being overweight. It is mainly because elevated blood sugar can lead to a constant state of low-grade inflammation and the generation of reactive oxygen species, triggering joint inflammation. Regular blood sugar monitoring and diabetes management may potentially slow arthritis progression and protect joint health. Number 7. Get regular checkups. Arthritis damage progresses over time. The longer you wait to seek treatment, the more damage your joints will suffer. Consult your doctor if you notice symptoms like pain, swelling, or stiffness in your joints. Doctors can identify any predisposing factors for arthritis, like being flat-footed or knock-kneed or bow-legged. Regular medical checkups are particularly vital for those with chronic conditions like diabetes or heart disease. Learn proper body forms from a physical therapist or sports trainer, and alternate your exercise routine to different muscle groups to prevent excessive stress on the same joints. In conclusion, we can say, arthritis is affecting millions worldwide daily. While there's no cure from it, lifestyle changes can prevent the risks. Regular exercise suitable for arthritis, maintaining a healthy weight, avoiding injuries by maintaining safety along with adopting ergonomic practices, consuming an anti-inflammatory diet, quitting smoking, managing blood sugar levels, and regular checkups can proactively protect joint health, enhance mobility, and alleviate the impact of arthritis on overall well-being. So, when did you last consult a doctor regarding arthritis? Subscribe and stay with us for a continuous stream of expert advice to elevate your daily living and embark on a path to a healthier you.